I'm Erin.
Hi, I'm Rashelle.
We are wanting to talk to you in this video about focusing on providers. And so this message is really going to be geared towards providers in a medical encounter. So we know we have a lot of interpreters and interpreter fans who follow and subscribe to this channel. So hopefully you'll also take some nuggets from this topic. So the focus that we have for the providers on this particular video is all about how do you as a provider keep control over your medical encounter even when you have an interpreter present. Sometimes we know what will happen is providers will feel like somehow the appointment is different, completely separate from what they normally do in their ordinary work and role as a provider. And when an interpreter is involved, that really shouldn't be the case. Providers really should be able to be themselves and do what it is that they do, even when there is an interpreter in the encounter. So here are some tips, some ideas that you can keep in mind to keep that control over that encounter in your medical encounter with a patient. So the first thing to do is to acknowledge that, yeah, it is going to be a little bit different because you do have an interpreter involved. So how do you kind of make those connections and set the scenario up for success? One of the first things to do is to take a moment, even before beginning the encounter, and having a little bit of a prep session, pre-session with the interpreter before starting the encounter with the patient. There's a couple of good times to do this. One, if you're working with an interpreter in an on-site setting, is to take a moment in the hallway with the interpreter and just discuss with them briefly what are the goals of the encounter? What is it that you're hoping to achieve, or what are your expectations in that encounter with the patient? So we're going to be giving test results, we're going to be examining some symptoms, we're not really sure what's going on. Give the interpreter a little heads up as to what your overall purpose and goal is for the encounter, and any other useful information that you might be able to share with the interpreter so that the interpreter is better prepared to enter that encounter and allow you to do what you do so well.
It is important, however, in that pre-session isn't to prompt the interpreter to then take lead, and we'll continue on in understanding all of that. It's to give them context, which will help them do the message conversion and the facilitation a little bit easier when you have that opportunity.
Now, we also know that we don't always have an opportunity to have an interpreter on site. Sometimes we have opportunities to have interpreters on video, and other times interpreters are on the phone. You can still do the same concept and same approach by giving those interpreters also a little moment to brief them on, prep them on what type of encounter it is and what are your goals or your expectations for that encounter, and any nuance or anything that might be uniquely interesting or important for the interpreter to know. So if you're interpreting with an interpreter who's over the video, maybe you have the video out in the hallway and you do the connection with the interpreter in the hallway before, entering with a tablet into the exam room. Or if you're on phone and it's in the room, you can still do a little bit of a prep and a brief in the room then as well with the interpreter.
And that's especially important, I think, in a remote setting with video or telephonic, because they aren't in the waiting room, they're not registering with the patient. The interpreter is coming into the encounter blind, and they're very capable to do so, but giving them a little bit of context about why they're there and what's going on, they're going to be able to pull from their memory. It'll just be a little bit easier for them with their flow of communication and just knowing what's coming, because that's a huge difference between the remote settings and interpreting and the on-site, is you really don't have that context prior to going live and, okay, now you're interpreting. So that context can be really, really helpful for the interpreter in doing their job well.
Another point to consider when working with an interpreter and keeping kind of that control of that appointment with the patient is remembering that you are still the expert in your area in the encounter.
You are the provider. You are there. You have a job. You have an area of expertise. Interpreters are trained with the vernacular, with the vocabulary, with the understanding of the environment that they're in. But because you've communicated what you're going for, if it's a test result or triaging a symptom or whatever it is, that isn't to then hand that off to the interpreter because the interpreter speaks the language, so now that they know what you want, they're going to do that. That's not the way that it works with an interpreter. They're there to facilitate. And in doing that, when you're yourself, that's how you make that really special connection with your patient. And that's how you get them to open up and have a conversation and really get to know them regardless of the interpreter that you're working with.
So segueing to the next point then, perfect transition here. remember that you should be talking with the patient through the interpreter. So your focus, your comments are all directed toward the patient, family members, as if it were any other encounter where you didn't have an interpreter. So keep that in mind, that your communication should always be including the patient, talking with the patient, and not, sidebarring to the interpreter who is maybe standing off a little bit, or to the speakerphone, or whatever the context is for the interpreter to be present there. So in talking with the patient through the interpreter, again, you'll be establishing that rapport. You'll have the pauses and the flow of communication. You'll be able to assess when it is that you want to go deeper into a subject matter and when it is you're going to come back to that later. You'll be able to do all the things that you ordinarily do in encounters that don't involve an interpreter.
And that really happens regardless of whether you have somebody on site, on video, or telephonic. It happens in different ways. And if you haven't worked with an interpreter in the way that we're speaking of right now, where you're speaking directly to the patient, it can feel a little weird at first. Interpreters interpret in the first person, so if the patient says, "I fell," you'll hear the interpreter say, "I fell." But if you say, "I want to know if this," the interpreter is going to say to the patient, "I want to know if this." And so it sounds a little weird. Interpreters kind of weird out about it in the beginning because it doesn't feel natural, but it actually really makes the conversations flow really naturally, to the point where eventually the interpreter really does step into the background regardless of where they're actually present. And so I would encourage you to try this out and really talk directly, make eye contact, and position your body language towards your patient, because again, that's going to build that rapport, that connection, and you're going to be able to treat their symptoms and their needs a lot better with building that trust. And that body language and eye contact really is important in that. So interpreters are there, but we definitely don't want to sidebar, and this is one key point in order for you to keep control of your encounter and have it be your rhythm.
The follow-up to that, as we're kind of already hinting at, is paying attention. Communication is about so much more than just the words that are spoken. Make sure to stay focused through eye contact, through paying attention, visually to the patient's body language, to gestures, to facial expressions. Pay attention to what's going on in the room amongst all the different participants. Don't, get locked into whatever the interpreter is doing or saying, or paying attention to whatever notations you're making on the screen or the charts, and trust that the interpreter is going to convey all of these things. So much of what is being communicated in an encounter is through the nonverbal aspects. So pay attention to those elements of communication as well, so that when inevitably there's a delay in the words that you're hearing, because it's either consecutive or simultaneous, so the interpreter is either speaking at the same time as someone, or the interpreter is taking the pause moment to communicate the message to you. Regardless, there's always a little bit of a delay, right? So staying engaged with the person who is speaking, even though you're waiting a little bit to hear the message in English, is important.
And in doing that too, it's another way to verify the interpretation. So if you are looking away from the patient as the interpreter is interpreting your message, or as the patient is talking and letting the interpreter do it and you're looking away, when the interpreter interprets back to you what's being said, if you weren't cognizant of the body language and the gestures and the things that the patients were saying and how they were saying it, and you weren't observing all of that, you might miss out on something, or you're not going to be able to tell if the interpreter is doing it wrong. There's memes out there about how, tell me why you're here today. Well, when I was 2 years old, this happened to me, and then I went this, and when I was 12, all to talk about, straining your back 2 days ago. That's not the interpreter's job to filter what the patient is saying. But if you're paying attention to the patient as they're talking, you're going to be able to pick up on all of those nonverbal cues and know that the interpreter isn't making something up. And vice versa, if you see the patient is really digging into a story and you see the interpreter come back with a couple of words or not convey the ups and downs of their verbal cues or style, that's another way to judge whether or not the interpretation is being done well, even though you don't speak the language. So be paying attention to the patient while they're speaking, even though you're not understanding it in the moment until the interpreter does their job, really is important, because that's another cue for you to manage your encounter and have control and know that and trust that what's being said is actually the intended message.
Final point of consideration and encouragement for providers and interpreters is to remember the importance of partnership. Each party in the encounter brings their own area of expertise into that room.
Absolutely.
So work within the scope of skills and training that you have. Work with the interpreter through the scope of skills and training that the interpreter has, and together work to achieve effective communication in every single encounter, no matter what the language pair, whatever the cultural dynamics are in that encounter.
Hopefully this was helpful to interpreters, but also for you providers. It doesn't have to be a scary thing working with an interpreter. There's plenty that you can do to make sure that an interpreted encounter runs as effectively and efficiently and productively as a non-interpreted encounter. So hope this helps everybody.
We invite everybody to also share their ideas of what's worked well when partnering with providers, or for your providers, what's worked well when partnering with the interpreters. So let's continue the conversation in the chat section of this video.
Share, like, comment, and we look forward to seeing you again soon. Have a great day, everybody.
Take good care.